Uganda.
Hello viewers, my name is Cheune Dorothy Yabazaire, the Executive Director of Uganda Blood Transfusion Services, or UBTS in brief. I'm here to take you through our journey, where we've been, where we are going, and where we want to be. UBTS started way back in 1989 when it was supplying blood to the Central Region within a radius of 100 kilometers. It has grown from the Central Region to different regions. We have about eight regions which are supplied by blood collection centers. These regions are in Arua, in Mbale, in Kampala, in Mbarara, in Fort Portal, and Masaka. All these regions are augmented by blood collection and distribution centers in Angar, in Nebi, in Soroti, in Jinja, in Hoima, in Masaka, Kitovu, Kabale, and Rukungiri. UBTS has a mission to provide safe and adequate supplies of blood to hospitals that need blood, and so has a vision that makes it active and be able to achieve its mandate for a long time. In relation to the Vision 2040 that is supposed to be mandated. We are a department in the Ministry of Health, and we are responsible to the Permanent Secretary, Ministry of Health, who gives us guidance and direction as where to want to be. The objectives of UBTS is to collect, process, store, and supply blood to all the hospitals that are accredited to transfuse blood, from the health center 4 up to regional, district, and private hospitals. All this blood is collected from voluntary non-human blood donors and is given free to all the hospitals that need blood. And nobody should buy blood because all this blood is collected free and given free. Our main activities is to mobilize for blood donation, collect blood, test the blood for transmission-transmissible infections like HIV, hepatitis B, hepatitis C, and syphilis. In addition, the blood grouping. You know that as much as we need to save lives, blood can also transmit these infections. So we have to make sure that blood is safe and make sure that it is given out safe to all hospitals and tested and even labeled that it is negative for all these markers. The main activities that are done is we have about 25 blood collection teams that go out every day in the field to collect blood. We also have fixed sites at the regional blood banks where walk-in blood donors can come in and donate blood. But most of our blood collections are through field operations, where we go, we interface with the schools, students in schools, we have corporates, we have markets, we have faith-based organizations, we have the army, we have the police, who have done a very good job in mobilizing for blood donation. And mind you, all this blood is voluntary. That means somebody is giving his or her blood upon his own will. Women can donate blood every 4 months, and men can donate blood every 3 months. And anybody who is above the age of 17 is eligible to donate blood. Of course, we have a vision, a mission, and a mandate. Our vision is to be an effective, efficient, and sustainable blood transfusion service in Uganda. So we really want to make sure that our services are efficient and within the budgetary allocations that are made by the government of Uganda, for which we are grateful. And we also have a mission, which is to provide sufficient and efficacious blood and blood components through voluntary donations for appropriate use in healthcare service delivery. Mark those two words, sufficient and efficacious. We must make sure that we achieve our targets. We must make sure that we satisfy our hospitals which need blood, and this blood must be safe. That's why we say it has to be efficacious through testing and making sure that this blood is collected from relatively safe, low-risk donor populations. And this blood must be collected from volunteer blood donors. Who are these volunteer blood donors? These are people who come and donate blood freely at their own will. If you are above the age of 17, and if you are a male or a female up to the age of 60 and feeling well, you don't have any medical condition, then you are eligible to donate blood. Don't go to hospitals looking for blood when you have not donated this blood, because this blood comes from human beings. There is no factory that can manufacture blood as we talk now. So this blood has to come from healthy donors like you, like me, like anybody else, and who must respond to our calls to blood donation. A woman can donate blood every 4 months, and a man can donate blood every 3 months, as long as you are feeling well. And we have also our mandate to make available safe and adequate quantities of blood and blood products to all hospitals in the country for the proper management of patients. When we talk about hospitals, those are the government hospitals, and also we have the private hospitals. All this blood is given free of charge, and nobody should pay for blood, whether you are in a government hospital or whether you are a private hospital. We give blood to government hospitals from the health center 4. So those hospitals are responsible for collecting blood from the regional blood banks. We are yet to start transporting blood to these hospitals when we get the resources available for this activity. We want to be like National Medical Stores, because National Medical Stores takes drugs up to the last mile. We wish we could do this, but it may not be possible because blood has a short shelf life. Blood expires after 30 days. So we may not know which hospitals need blood and which hospitals may not need blood. So that is why it's quite a challenge. We do wish to do this, but we wouldn't want to waste the precious gift of blood that has been given by somebody. So we also have our strategic objectives, and one of them is to increase blood supply for the management of patients in need of blood in healthcare facilities. We are yet to reach the WHO requirement for blood. WHO mandates a country to collect at least 1% of its total population. In Uganda, we are about 45 million. So if we are to meet our hospital blood needs, we need to collect at least 450,000 units of blood per year. But due to challenges, financial, human resource, we are only able to set a target of collection of 300,000 units of blood per year. And we are yet to achieve this target. We can say we are about 95% to achieving this target, but we hope we shall be there, God willing. We also have an objective to increase blood transfusion infrastructure stock in the country. We have had 5 purpose-built regional blood banks. These are in Gulu, in Mbale, in Kampala here, which is the headquarters, in Mbarara and Fort Portal. But according to the Health Sector Strategic Plan 2, every regional referral hospital was earmarked to have a regional blood bank attached to it. So we have started the construction of Soroti Regional Blood Bank. We are in the process of starting the construction of Arua Regional Blood Bank. We are also in the process of starting to construct Hoima Regional Blood Bank. And eventually we hope to make sure that each regional referral hospital, and there are about 15 in number, will also soon have a regional blood bank attached to it to make services nearer to the people. We also have an objective to promote appropriate clinical use of blood in hospitals. We have had many challenges. When we go to hospitals, we find that our blood is being wasted by the clinicians. Some of them give this blood when they shouldn't give the blood, and leave those patients who may need this blood to suffer. So we have this objective. We have started on this program. We have a quality department which is responsible for educating our clinicians on the appropriate use of blood, to use blood only when it is needed for that patient whose HB is below 5. And we educate our clinicians to use this blood for mothers with complications of pregnancy and childbirth, for children with severe anemia due to malaria, for accident victims. I think many of you see there are a lot of border accidents. When these patients end up in hospital, they have lost a lot of blood, so they will need a transfusion. We also have cancer patients who may need blood and its products. And we also have other patients like sickle cell patients. I think all of you know sickle cell anemia is quite rampant in Uganda. Then we have those heart surgeries whereby the healthcare service delivery has improved. You find that there are heart operations, and in these cases, patients will need blood. We also have another strategic objective to strengthen the organizational capacity of UBTS to enable efficient and effective service delivery. We intend to expand our structure, organizational structure, because we have realized that if we have to collect more blood, then we need to increase on the human resource. Each blood collection team of the 25 blood collection teams has about 10 members of staff. And these include a senior nursing officer, 2 phlebotomists, a blood donor recruiter, a counselor, a donor care assistant, and a clerk. We hope that if we increase the number of teams, then we shall be able to reach the WHO requirement of 1% of the total population. We also have another objective to promote and support research and development in blood transfusion service delivery. You know, ICT and the world is always changing, and blood transfusion is also improving. So we have a research and development department that is trying to catch up with what is on form, with what is coming up. Do we have a new drug that can help us with the blood? Do we have new testing algorithms? Do we have new infections that need to be brought to the testing laboratory? All these can be achieved through the objectives. Now, what are our activities? I think many of you have seen our vehicles with numbers, with markings. Safe blood saves life. We have 25 blood collection teams, and these teams are responsible for mobilizing for blood donation, for collecting blood from blood donors, and for transporting this blood to a regional blood bank. As I said, each of these people go out in the field. They have to make sure that those who are willing to donate blood go through our donor selection process. This selection process makes sure that you are fit to donate blood, so that blood donation does not harm you, the donor, nor would it harm the recipient of your blood. So the donor goes through a health questionnaire and a medical examination. We make sure that your hemoglobin is normal. We make sure that you have the right weight, and we make sure that you are not on any medication and you are fit to donate blood. And when you donate this blood, we always take about 450 ml of blood from you. This blood can be separated into blood components, into red cell concentrates, into platelets, into plasma, so that this unit of blood can save more than one patient, especially children. And when we collect this blood, we give you something in return for your precious gift of blood. We give you a drink, and we give you a recognition to make sure that your precious gift of blood is recognized, and we give you a card and encourage you to come back for your results, so that you become a regular blood donor. After we collected this blood, we take it to the regional blood bank, we store it under the cold chain, and then we test this blood for infection markers. These include HIV, hepatitis B, hepatitis C, and syphilis, in addition to the blood group. Remember, HIV is in Uganda, hepatitis B is among our donor population, and hepatitis C is also in Uganda. And these infections can be transmitted by blood. So we need to test this blood to make sure that we don't transmit infections through blood transfusion. And it's only that blood that is negative for all these markers that is labeled and is given to hospitals that need the blood. And we also make programs to take results to those donors who may wish to know their serostatus, who may wish to know their blood groups, and who may wish to enroll and become regular blood donors. Because all we know is that a regular blood donor is the safest blood donor because he has been educated, because he has undergone several tests, and because he is willing to come up and give blood. Much as we try to achieve our objective, we have a number of challenges. One of the biggest challenges is the responsiveness of the community towards blood donation. Many of the adult population don't want to donate blood. They always leave this activity to students in schools. When we had the COVID pandemic, we had a very, very big challenge. The schools were closed, there was total lockdown, the communities were closed. So we got a very, very big challenge, and we had to devise new ways of working. Because remember, patients were still going to hospitals, mothers still needed blood, children still needed blood, accident victims needed blood, sickle cell patients needed blood, and even cancer patients needed blood. So we had to devise new ways of working. We decided to engage a call center. We set up a call center where we would call upon donors to come and donate blood. And we would even go to the extent of picking these would-be donors to come and donate blood. We also decided to split into smaller groups where we would engage communities in smaller groups to be able to give us blood. And this added additional costs. We had to procure masks. We had to procure soap as donor incentive so that we could encourage these people to continue donating blood. And luckily enough, after that, so many communities, so many corporates bought the idea and started sponsoring blood drives across the country. In this, we have the Kabaka Foundation, for which we are very, very grateful. We have the Army, We have the police. They've really helped us in times of need. We are really forever grateful to them. And I'm glad to report that the last financial year, we even exceeded our target. We collected more blood than we always collect. So we have had these new ways of working in the communities, working in markets, working in taxi parks, and they have yielded good results. So the community has come up to respond after the COVID-19 pandemic. So we thank all those who have helped us. We thank all those who have partnered with us, and we encourage you to continue, because blood is needed every day. Blood is needed every hour and every minute. And mind you, this blood takes only 30 days to expire. So we always have to collect in order to balance what we give out to that what we collect. So as a way forward and future plans, we intend to improve on our infrastructure. We intend to increase on our blood collection. We intend to work with the partners, because we realize this is the way to go, to engage donor communities, to engage corporates, to make effective use of our call center, to have the blood donor registers, to have negative registers. You know, there are many people who have different blood groups. One can be blood group O, one can be A, one can be B, AB, and either can be rhesus positive or negative. We have had a challenge of rhesus negative blood. That's when we find calling up blood donors who are rhesus negative from our call register to be able and come to donate blood to save life. So we shall continue to improve on infrastructure. As I told you, we are constructing Soroti, we are constructing Arua, we are constructing Hoima, and we want even other regional referral hospitals to be able to have a regional blood banks. As I said, the challenge, it was the lockdown due to COVID-19 pandemic. We have staff who contracted COVID. We have staff who couldn't come to work because there was no transport, but we managed to mitigate these challenges. Another challenge is a frequent breakdown of vehicles due to old age. Most of our vehicles, 55 of them, have broken down. They've been used for more than 25 years. So we need to replace our blood collection fleet, because most of these vehicles, as I said, blood is collected from the field. And we travel long distances in the terrain. Now you can see the rainy season. So we really need sound, robust vehicles to be able to collect blood. Even we have another challenge of lack of laboratory equipment, like centrifuges. As I said, 1 unit of blood can be broken down into 4 components to be able to save 4 lives. But most of our regional blood banks do not have these centrifuges, so they cannot prepare components apart from red cell concentrates. We have another challenge of the inadequate staffing. As I told you, we need to increase on our blood collection teams to be able to collect more blood. There has been a ban on recruitment, and the organizational structure is so constricted that we cannot recruit more staff. We have ended up using volunteer staff who are helping us to bridge this gap. Of course, just like any other organization, we have inadequate operational costs. As you see, fuel has gone up, and most of our activities are fuel related. So this is a very, very big challenge for us. Although we are grateful to government, it has increased its funding, but I think we may need to have additional funding to be able to mitigate this fuel crisis. Even then, there are rumors, let me call them rumors, in hospitals where patients go and they're asked to pay for blood. I encourage our patients, I encourage our people, please don't buy blood. You commit a crime by buying blood, and any of those people who are selling you blood also commits a crime. We have our toll-free numbers whereby you can call us and report this person who is selling you blood, and will be a learning lesson for the others. We shall be able to prosecute, but we cannot work on hearsay unless we have somebody that has been arrested selling or buying blood. So I encourage you, please don't buy blood, and let's make sure that we donate this blood so that it is in plenty. If the blood is in plenty, then there is no way you can be sold blood. But there are times when there is no blood, especially during the holidays, when we don't have enough, then I think all these bad habits can come up. But if we can make sure we collect a good amount of blood, and if blood is always available in the hospitals, then this vice can be mitigated. So please do not buy blood, and you can always call us if you need blood. We shall be able to respond to your needs. So I want to appeal to all those people of Uganda who are above the age of 17 up to 60 years, if who are feeling well, to come up and donate blood. Thank you, our Ministry of Health. Thank you, Ministry of Finance, for giving us the resources. Thank you, our Health Committee, for always advocating for funding for UBTS. And I wish also to thank the government for giving us the opportunity and giving us increased resources to be able to achieve objective. I also want to thank National Medical Stores. They have done a good job of supplying reagents and all that we need to do our activities. I want to thank the Army, Police, and Kabaka Foundation for the partnership in this exercise. Lastly, I want to thank UBC for giving us this opportunity to take us through this journey of UBTS from its inception to where we are and where we want to be. And to thank all those blood donors who have given their precious gift of blood. Please continue to donate blood, because without blood donors, there's no blood bank. And safe blood saves life. For God and my country.
UBC, inspiring Uganda.
Years ago, men and women who were less advantaged than us today started